Thank you for joining us for the 7th episode of our series. Hello, I'm Dr. Franck Yata. Today, I'll be talking about the uniqueness of my care plan. But first, I'd like to ask you to please subscribe on YouTube and all other social media to support us. We ended episode 6 by saying that in the case of premature ejaculation, we also recommend mental defocusing or deconcentration techniques to reduce psychological pressure and thus maintain an erection for as long as possible. As you know, there is a threshold or peak or summit or highest point of mental arousal that should not be exceeded at the risk of initiating the ejaculation process. If a man can consciously control his ability to reach, or better, not reach this threshold, he will theoretically never experience premature ejaculation. Today, there are several techniques that allow you to voluntarily control this threshold. We'll discuss them in later broadcasts. And in our private consultations, we learn how this works in practice. The third front of erectile dysfunction treatment is surgical, where the doctor primarily prescribes penile implants. This front is recommended when the previous 2 treatments have not yielded good results. However, it must be recognized that the satisfaction rate is quite high here. The fourth front will involve addressing underlying conditions. For example, the doctor will prescribe testosterone replacement therapy, TRT, which aims to restore testosterone levels in men with low testosterone. This treatment can help relieve symptoms such as low libido, erectile dysfunction, fatigue, and muscle wasting. However, TRT also carries potential risks, including an increased risk of prostate cancer, heart problems, and polycythemia. The doctor will also add psychological therapy, especially if anxiety, depression, or trauma are contributing factors. He will likely prescribe couples therapy to improve intimacy and communication, which is extremely important in the management of erectile dysfunction. In fact, most of these treatments, especially those on the first 2 fronts, are applied for every intimate relationship, whereas we should be thinking of finding a solution that would allow the patient to recover his erectile function, as in the good times of his youth. This is why the next chapter will be particularly interesting, as I will present my treatment principle and its originality. Erectile dysfunction, Dr. Yata's treatment principle. Based on my training and my medical practice of 20 years, combined with the experience of my close environment made up of peers over 50 years old, and especially my own experience as a couple, I have been able to offer a treatment that gives positive results. Indeed, without neglecting or contradicting the basic principle of treatment that I have just described, it seemed essential to me to add the following techniques and actions. 1. Specific pelvic massages, such as those I offer. Here, a professional therapeutic masseuse, to whom I have meticulously taught my technique, will perform this massage on you, preferably in the presence of your wife, so that if necessary, she can perform it herself at home. 2. Modified Kegel exercises, as I suggest them. Here, a fitness coach, who I also taught the exercises to, will guide you for a good period. 3. Natural ingredients and dried fruits commonly consumed by men in the villages of the Democratic Republic of Congo. Here I will recommend taking natural products in a combination, the proportions and frequency of which I suggest. 4. Active participation of the partner on both a psychological, mental, and physical level, including an audiovisual component. Some men do not want this, but this step is crucial in our approach. Your wife is entirely part of the problem, because it is the lack of her satisfaction that hurts you the most. So she must be just as much part of the solution process. This comprehensive approach is original and sets me apart from other doctors who treat erectile dysfunction. I will talk about it superficially, but if you want to know more, you will have to visit our official website and take the first consultation, which is completely free, in order to establish a treatment principle that corresponds exactly to your situation. Remember that dysfunction is actually primarily a psychosomatic manifestation that depends deeply on each individual's situation. Therefore, treatment is personal. What works for him won't work directly for you. One thing to remember is that erectile dysfunction is not and should not be a taboo subject. You must be able to talk about it freely. If you suffer from it, know that it is not a shameful subject either, and above all, you are not alone. There are 400 million other men who suffer from it. Hundreds of thousands of doctors have chosen it as their specialty, so you are not alone at all. And finally, it is curable and it does not kill. So, that's the end of the basic and introductory course we've planned for you on erectile dysfunction. Thank you for following us so far. If you'd like, we'll start live broadcasts to answer your questions in real time, either publicly or privately in a chat box. Thank you for your support. Now, let's get on with the interesting discussions and answer your questions. Feel free to ask questions and, above all, contact us by phone or visit our official website.